The implementation phase is the fourth step in the nursing process. I'm not going to beat a dead horse here too much, guys. This is where you do it. This is where you do the interventions that you have planned. So let's talk about it really quick, though. Like I said, it's the fourth phase of the nursing process. This begins right after we plan our care. The RN is going to evaluate the interventions and if they worked in the next phase. So what we do here, guys, is we basically execute our care. We do our planned interventions. One thing I want you to keep in mind here, guys, is that you need to be confident. All right. What can happen here is during this first phase, of the nursing process, the assess, diagnose, planning, all these different phases, we've been gathering all this data. We've collected all this information, and now it's time for us to go do what we need to do. You need to do these things confidently. Don't walk in there scared. Don't walk in there timid. Walk in there confident. You've made your decision. Go in there and perform your care as if you've done it 100 times. Your patient doesn't want to see you walk in there all scared. They want to see you walk in there confident, comfortable in what you're doing. So have confidence at this phase. You've collected the data. You've made your decision. Now go in there and do it. Sometimes these things that we plan to do, these things that we implement, they just don't work. That doesn't mean that you're a bad nurse. You're not a bad nurse if your interventions don't work. Okay, sometimes world-class athletes trip on a hurdle in the Olympics. That doesn't mean that they're bad runners or they're slow. That means it just didn't work that time. Okay, an intervention might not be available. The patient might have an unexpected reaction to something that we didn't know about. So if it doesn't work, that doesn't reflect poorly on you. The patient might be dehydrated. You might not be able to get a vein. Nobody might be able to get a vein. So just be easy on yourself during this phase, especially if interventions don't work. You can follow up with people if they aren't working. You can follow up with your charge nurse first. You can follow up with other veteran nurses who maybe have more experience on the floor or who've done this before. You can follow up with other providers or physicians. If you say, this is what we plan to do and it just didn't work, and here's all the data I've gathered and this is why I did this and it just didn't seem to work, follow up with these people and they're going to be willing to help you. We all want the patient to be good. We all want the patient to get healthy. So follow up with these people. They're going to help you out. Now, the nursing concepts you need to keep in mind here are professionalism and clinical judgment. Again, using your judgment, using all this data, all this information that you've gathered to then go implement the care that you have determined is best for your patient. So the key points are here, guys. Biggest thing is just do it, right? Just do it. Don't tell Nike. I don't want them to sue me. But once you've decided what you're going to do, go do it. That's as easy as it is. Deliver the care with confidence. The first thing here, guys, is you need to know your stuff. Learn all that you can, practice all that you can, and then when these interventions arise for you on the floor, go in there and do your stuff. And then be humble. Sometimes interventions don't work. That doesn't mean you're a bad nurse. Sometimes things just don't work. Sometimes there might be a different option or something might work better for a patient. One thing to keep in mind here, guys, as you're taking NCLEX questions, what should the nurse do next doesn't always mean implementation. Make sure that you're following the nursing process. Don't just jump to action means implement. Your first action might be an assessment or something like that. So don't get caught in that NCLEX trap. We do talk about that in the test taking course. All right, guys, I hope that helps. Dive into the other lessons here and just realize, and what I want you to keep in mind here is have confidence when you implement. Talk to your patient clearly, talk to them cleanly, and then go in and just do it and be humble if things don't work. You guys can do this. I know you can. Go out and be your best selves today. Happy nursing.